My name's Dave Adair. I'm a maternal fetal medicine specialist based here at UT-Chattanooga, and I'm the director for the Southeast Regional Perinatal Unit. The program was kind of revolutionary in its time because very few states had such a regional organized program to providing care for the high-risk neonate and the high-risk mother. So Tennessee is to be commended for being on the forefront of that. The second aspect of it, where we are now, is that like a child, we've kind of grown up and we're actually kind of teenagers now. So we're at a point now where things are beginning to change. We have more complicated patients, the babies are more complicated, and so with that, the regional perinatal program has also matured. And so those two things together has been the biggest change that I've seen in my 17 years. Telemedicine's helped on another front, which is there's always the rub. Being from a regional program, you're coming in. Are you a spy? You're an outsider? You know, there's the anxiety, the angst that goes with that. By being part of those communities on a regular basis, a lot of the facilities were actually on labor and delivery or associated with that local hospital. So we're helping them to improve care. We become active in the community, and they realize that we're there not to take patients. But I think as over the 17 years with advertising and I think with good education, we're seeing some of those things be combated, and so that they do seek care. So that would be the two big things that I would think of right off the bat.
When we first began trying to regionalize our state, which was something that we realized across the United States was a valuable thing for the local hospitals, they were pretty receptive to that, actually, because it's very difficult to take care of a really sick baby without the resources. So they were happy to send them along to the level of care that they needed. And we make ourselves very available to them. They know our phone number. In fact, we even carry a cell phone around so they can contact the physician directly. We often say it takes a village to take care of one of these little children. And we have specially trained nurses, we have nurse practitioners, respiratory therapists who do nothing but pediatric respiratory therapy. So we have social workers, we have a whole gamut of people who function as a team, literally, to be able to provide all the services these families need.
I've been in places with state regional perinatal programs and in places where they did not have it. And in my opinion, the places that have it have the best continuity of care for the moms and the babies that you can have. When we go out in the region and we teach people how to take care of a sick mom, how to take care of a sick baby, how to resuscitate them, how to stabilize them until they can be picked up and until they can be transported. If everybody is well educated, your information that passes among the professionals, from EMT paramedics to outlying hospitals to the regional center, everybody knows what you're talking about because they're all educated. They all have the same information. We have wonderful physicians. We have wonderful staff. We have a fabulous transport team, and that includes respiratory and nursing and life force, the life flight people, everybody. You know what? It's a team, and you can't do it if you're not a team.
I would encourage anybody who views this tape to get in their car and get out and go and look, because we have a lot of pockets of people who are economically depressed, and by engaging them, giving them hope, we can help to break cycles of generations of these people having these obvious maladies. Being in those communities and floating their boats with health care, ultimately we need to address the economics and try to bring things in there that helps float everybody's boat. But long story short, being on that front line in partnership with the local docs, so that the IE, the general, and the backfield at headquarters, you know, is on the front lines there with you, ready to fight whatever comes in. I think that's been the best thing that I can think of, and one of the best stories that we could tell as the regional program in Chattanooga.